Oh fuck, man. I love the way they had to state it was greasy. Like they couldn't just, like earlier in the article they just said diarrhea, now they have to sort of describe the consistency of it. Anyway, what's going on, guys? This is Jacob from Sunday Lifters. In this video, this video first off is probably going to be the least popular video I've done, but at the same time hopefully the most useful for those it's applicable to. I'm going to be looking at selective androgen receptor modulators, or SARMs as they're sort of commonly referred to as. SARMs have been popularized very recently, like we're talking the past year or so, maybe 2 years or whatever. I was actually really surprised to find out that in London, obviously under London, they've got the Fatberg, right? And they took a sample from that and they actually found there was more trace of SARMs in the sort of sample they took as opposed to things like cocaine and MDMA, which are obviously kind of commonly used drugs in the city. And that really surprised me. So it kind of woke me up a little bit how much these get used in my country, in the UK. There's sort of 4 SARMs that are probably the most popular. You've got LGD-4033, you've got RAD-140, you've got Osterine, which is MK2866, and then you've got Anderine, and I'm not quite sure what the lab name for that is, or the sort of chemical name, if you will. The 2 we're going to be looking at today in this study is LGD-4033 and RAD-140. Those 2 have arguably become more popular over the past year, as opposed to sort of traditionally Osterine and Anderine were probably the more popular 2. The question we're going to be sort of answering today is, are these substances liver safe? SARMs were originally developed to sort of be more tissue selective than androgenic anabolic steroids, and to some degree they were a success in that they are. However, it doesn't mean, there's a lot of people in the fitness industry who say, you know, SARMs are way safer than steroids. However, you've also got some that are sort of saying it's completely safe and there's nothing to worry about. And as with everything, the sort of dosage and the duration makes the poison. But I don't feel like people know what sort of dosages they should be taking of this stuff. They're just taking it at what they think is a safe dose. And it turns out it doesn't actually have to be that high of a dose for you to develop problems. So that's what we're going to look at here. We're going to go into a study now. Like I say, this is just covering LGD-4033 and RAD-140. So we're going to go over the abstract first. The abstract in this study will sort of help sum up the answer to that question: are these substances liver safe, in quite, you know, a concise way basically. So probably take us a couple of minutes, and then if you want to exit the video you can. From there you'll have your answer. If you want to look into the full study and sort of get more context behind it, I am going to go through the full study, so you can stick about for that if you want to. So I'll mark out when we've done the abstract, and then if you want to exit you can. So here we go. This is a study done by ACG Case Reports Journal. Drug-induced liver injury associated with alpha bolate, which contained RAD-140, and alpha elite, which contained RAD-140 and LGD-4033. Let's go to the abstract, which sums up the study. We report a 52-year-old man who developed drug-induced liver injury after taking alpha bolate and alpha elite, which contained the SARMs we're covering. Supplements. Liver biopsy demonstrated diffuse central lobular canalicular cholestasis, prominent ductular reaction, and mild lobular inflammation with rare non-necrotizing epithelioid granuloma, suggestive of drug-induced liver injury. So let's break that down. So first off, it says the liver biopsy demonstrated diffuse central lobular canalicular cholestasis. In order to know what that is, we've just got to break it down a little bit. We need to know what lobules are. Lobules are sort of little divisions within the liver that are sort of defined at a microscopic or histological scale. So with that in mind, central lobular canalicular cholestasis. What is canalicular cholestasis? This is basically where bile thrombi is found within bile canaliculi. Bile canaliculi are like little thin tubes that we have within our liver that sort of receive bile from hepatocytes. And what bile thrombi is, it's sort of intracanalicular bile that gets stuck in the tubes, sort of usually as a result of drainage or stopping drainage from happening. And also this is going to be sort of, it's going to restrict blood flow to certain tissues. So there's quite a lot of problems that canalicular cholestasis can cause within us. A prominent ductular reaction. So he had a prominent ductular reaction. That basically means he experienced the rapid proliferation or multiplication of reactive bile ducts in the liver, usually induced through liver injury. That can cause sort of hepatic atrophy, which is where the sort of liver grows. It can lead to cholangitis, which left untreated usually always leads to death. It can cause portal hypertension, which is, could more than likely will lead to sort of bleeding in the digestive tract. So a ductular reaction doesn't sound good, man. And mild lobular inflammation with rare non-necrotizing epithelioid granuloma suggestive of drug-induced liver injury. Non-necrotizing epithelioid granuloma is a bit of a mouthful. Let's break it down. Non-necrotizing means non-cell killing. Epithelial cells are sort of found throughout the body, but they're sort of concentrated more in certain areas. Particularly, there's a lot of them found in glands that we sort of have throughout the body. Epithelial cells, and granuloma is basically long-standing inflammation. So broken down, what that's basically saying is there were signs in the liver of long-standing sort of inflammation in the sort of epithelial cells in the liver, we should say, that were sort of conducive of drug-induced liver damage, as opposed to something like fatty liver disease from alcohol or sort of bad diet or anything like that. So now let's just go over that one more time in context. Liver biopsy demonstrated diffuse centrilobular canalicular cholestasis, which is the buildup of bile within the bile canaliculi, prominent ductular reaction, which is the rapid multiplication of reactive bile ducts, and mild lobular inflammation with rare non-necrotizing epithelioid granuloma suggestive of drug-induced liver injury. So, like I say, just long-standing sort of inflammation within the epithelial cells in the liver. Liver enzymes return to normal levels approximately 3 months after the patient stopped both supplements. We present the mechanism of drug-induced liver injury associated with 2 selective androgen receptor modulators, including RAD-140 and LGD-4033. So there you go, that's sort of the end of the abstract. It sort of sums up some of the problems this guy had through doing RAD-140 and LGD-4034. I would advise carrying on with the video just so you can see the sort of dosages this guy was taking, especially if you're thinking of actually doing this shit, or you already are, and you need to be aware of what sort of dosages you should be avoiding, basically, to stay healthy. So like I say, if you really want to, you can exit there, but just know there are some serious problems, and hopefully as I've gone along I sort of outlined some of the long-term problems some of these things can cause. I've given the article a bit of a skim, and it seems a lot less jargon heavy as I go on, and I know which bits sort of are relevant, or at least for most of the article at this point. So RAD-140 and LGD-4033 are non-steroidal selective androgen receptor modulators, or SARMs, that bind as a ligand to the androgen receptors and express tissue selective activities. SARMs have a highly selected anabolic effect on muscle and bones, with antagonistic features in productive organs such as the prostate. Therefore, SARMs have been investigated for the treatment of osteoporosis, sarcopenia and cachexia. However, their use in clinical practice remains unapproved by the FDA owing to potential misuse of their anabolic effects. They were added to WADA's prohibited list. However, they are sold as dietary supplements over the counter and on the internet, causing a serious threat to public health. We present a case of severe drug-induced hepatotoxicity associated with RAD-140
and LGD-4033.
So this is like what I was saying at the start. When SARMs first came into development, they were looked into because they were more tissue selective than androgenic anabolic steroids. I think people also thought that they would be, or missing entirely the androgenic element of that as well, which isn't entirely true. But yeah, so I think this is where the whole they're much safer than steroids sort of position comes from, which it just isn't true really. Obviously there's a lot of different SARMs. There's some I don't even know about, like there's all the underground shit. Maybe there are, in general, maybe there are some that are more safer than steroids. I'm not going to dispute that, but are they entirely safe? Like, fuck no, man.
So, case report: a 52-year-old white man without chronic medical problems presented to our hepatology clinic for an evaluation of elevated liver enzyme and jaundice. Jaundice is yellowing of the skin or eyes. His symptoms included right upper quadrant pain, jaundice, pruritus and diarrhea that started approximately 3 months before his presentation to the clinic. Approximately 4 months before his presentation to the clinic, he started taking 2 capsules of alphabolic. 1 capsule contains 10 milligrams of RAD-140. The bottle contained 60 tablets. He took that daily for 4 weeks. After he finished that, he started taking 2 capsules of Alpha Elite. Each capsule contains 7.5 milligrams of RAD-140 and 5 milligrams of LGD. The bottle contained 60 tablets, and he took that daily for 3 weeks for muscle building. The total duration of the supplement consumption was 7 weeks. Soon after that, he developed jaundice, right upper quadrant pain, pruritus, and greasy diarrhea.
Oh, fuck, man. I love the way they had to state it was greasy. Like, they couldn't just... Like earlier in the article, they just said diarrhea. Now they have to sort of describe the consistency of it. Anyway.
His medical, surgical and family histories were non-contributory. He reported drinking bourbon and beer on a daily and using marijuana. Did I just say on a daily? Brilliant. The vital signs were normal. The physical examination was normal except for scleral icterus and jaundice. So he was walking around like a fucking Simpson, basically. Like I say, yellow eyes, yellow skin. The initial laboratory results were as follows. I'm not going to go through all of these, as you can tell. It's a bit of a mouthful, but there are some important ones we should monitor or take note of. Alanine aminotransferase, 46 units per litre. Total bilirubin, 34.5 milligrams per deciliter. Let's have a look. So he had a normal complete blood cell count. Abdominal magnetic resonance imaging showed no gallstone or biliary dilation. The patient underwent an ultrasound guided liver biopsy that showed diffuse central... Right, this is just what it summed up at the top. Let's have a look. Oh, there's a figure for what we spoke about earlier. We'll take a look at that. The liver biopsy also showed mild to moderate hemosiderosis. However, the hepatic iron index was 0.6. His hemosiderosis was likely secondary to his history of alcohol use. That is basically where there's little sort of build-ups or deposits of iron within the tissue. The etiology of the liver disease was most consistent with a cholestatic drug-induced liver injury. R factor was 0.2. Not gonna lie, I don't know what that means. The patient was instructed to remain abstinent from taking any supplements and stop alcohol. Bilirubin, ALP and aminotransferase levels significantly improved approximately 3 months after the patient stopped the supplements. Aspartate aminotransferase was 37 units, which went up a unit per litre, which is quite a lot in blood work, guys. Alanine aminotransferase, which you'd want lower than he had, which was 46, that's gone down to 30, and ALP, which would also, I can't remember what ALP, I didn't look actually what his ALP level was. Where is it? Here we go. Alkaline phosphatase, ALP 529 units per litre, and that went down to 121 units per litre. So we can pull up a figure here which actually is going to show us a visual representation of what we discussed, or sort of, you know, learn in the abstract. So the liver biopsy showing canalicular bile plugs, which, can I zoom on this? Yes. These little nasty bits of brown here, they're the little sort of bile plugs, the sort of what's blocking up the bile canaliculi. On image B, as we can see, portal tract with bile duct damage and cholangular proliferation, which is, you know, this concentration of all these purple dots here, like we were saying earlier, the rapid multiplication of cells. They should be more sporadic, like over here. And C, non-necrotizing epithelioid granuloma in the lobule. Let's zoom in again. Let's just have a little look. So yeah, apparently this area here would be experiencing sort of chronic or long-term inflammation. So this here is like an ingredient profile for alpha-bolic and alpha-elite. We don't really need to go into that right now because we're sort of covering the SARMs found within. But this bit here is probably relevant. So although SARMs are not approved by the FDA, they can still be purchased from various websites or over the counter without a prescription. A study evaluated the ingredients of 44 dietary supplements sold as SARMs. According to this study results, 39% of the dietary supplements contain unapproved drugs other than SARMs, including ibutamorin, a growth hormone secretagogue, GW501516, a peroxisome proliferator activated receptor delta agonist, I think I said that correctly, and SR9009 reverber agonist. The mass spectrometric analysis of these dietary supplements revealed that only 52% of supplements sold in the market contain SARMs, and the remaining supplements were mislabeled.
I've got to be honest, I was really fucking surprised at how easy it was to find SARMs online, and pretty much if I wanted to, I could get them delivered to my door. So it's no surprise that people are buying this stuff and not sort of knowing anything about it and just going into it. It's not that hard to find. I mean, what it's basically saying there is a 48% chance of what you buy on the internet is going to be fucking garbage and a waste of money and not even have the active ingredients you're sort of trying to get in them. So, you know, I mean, that's a financial risk within itself.
This case illustrates drug-induced liver injury in the setting of RAD-140 and LGD. However, it is possible that both alpha-bolic and alpha-elite pills had another unapproved substance that had not been reported by the manufacturer in the drug label.
I mean, yeah, if they're willing to lie about the active ingredient within it and sort of, you know, there's a 48% chance it's not even going to have the SARM in it, it would be no fucking surprise if they were putting stuff in there and not putting it on the label. So, you know, it said unapproved substance. It wouldn't surprise me at all if there was multiple undeclared substances found sort of within these products.
In addition, Alpha Elite contains 5 milligrams of LGD per capsule in addition to the RAD-140. The amount of LGD reported in Alpha Elite is 5 to 50 times higher than the daily amount of LGD that was administered in the placebo-controlled trial of LGD conducted in 76 healthy men. Different doses of RAD-140 were tested in male monkeys and no elevation greater than 2-folds of the baseline levels were observed in liver enzymes. Our patient took 20 milligrams of RAD-140, so they tried in the monkeys 0.01 milligrams per kilogram, 0.1 milligrams per kilogram, and 1 milligram per kilogram. It doesn't actually say over what time period, but I would assume a day. So yeah, you know, quite minuscule compared to what our guy in the study was taking. So our patient took 20 milligrams of RAD-140 daily for 4 weeks, and after that 15 milligrams of RAD-140 daily For 3 weeks, the weight-based RAD-140 doses that the patient took were approximately 0.25 milligrams per kilogram and 0.19 milligrams per kilogram of alpha elite, and higher than the weight-based RAD-140 doses of... Oh, okay, so yeah, there we go. It gives how much higher his doses were as opposed to the monkeys. Although the patient had a history of alcohol use, there were no histological features of acute alcoholic hepatitis noted in the liver biopsy. In contrast to the cholestatic phase of acute alcoholic hepatitis, that usually presents with histological features including steatosis, very prominent ballooning degeneration with well-formed Mallory-Denk bodies, neutrophilic satelitosis around the Mallory hyaline, and a pericellular fibrosis along with cholestasis in the liver biopsy. This patient had no steatosis, ballooning generation, basically everything it just listed, I would assume, other than the cholestasis. So specifically, he had a largely bland canalicular cholestasis. One focus of, it's just going to say the symptoms he had again. After ruling out other possible causes of acute liver injury, the diagnosis was made based on the timing of administration of RAD-140 and LGD-4033 that the improvement of liver enzymes after the patient stopped taking the supplements and liver biopsy findings. Although there were no histological features of acute alcoholic hepatitis in the liver biopsy, alcohol use may have predisposed our patient to the SARMs-associated drug liver-induced injury.
Yeah, absolutely. I mean, his long-standing history with alcohol could have absolutely predisposed his liver to, the problems he faced. But, a lot, what it was sort of saying earlier is all those sort of things like steatosis, ballooning degeneration with well-formed Mallory-Denk bodies, neutrophilic satelitosis, all of those things are sort of not conducive of drug-induced liver injury. The things he experienced were sort of typical symptoms of drug-induced liver injury, and plus the fact that those symptoms problems he had went away when he stopped the drug use absolutely indicates that it was the drugs. Like I say, no way to prove whether his history with alcohol did or didn't play a role, but is it worth taking the risk?
In conclusion, we reported severe drug-induced hepatotoxicity associated with RAD-140 and LGD-4033. Although RAD-140 and LGD are not FDA approved for clinical use, they are freely sold over the counter and via the internet as dietary supplements. A higher level of regulation for these products is required to protect public health. And that is the end there, guys.
So based on this study and everything we've just read, it would appear as though the answer is no. SARMs are not liver safe. Like I say, there's a lot of underground ones still in development. Perhaps they might get it to a point where they develop the tissue selectivity even more in these substances, and we get a liver safe SARM in the future. But certainly RAD-140 and LGD-4044 do not appear to be entirely liver safe. Like I say, you can always put it down to perhaps you will have these things and be fine, but there's no way to sort of know for sure, not without a sort of medical expert at your side anyway, which most of us don't have access to. It would not surprise me at all if people were taking higher doses than the guy in the study. I think he was taking 2 pills of 10 milligrams of RAD-140 for the first 4 weeks, so that's 20 milligrams a day, which is not even at the high end of like what I imagine people would be taking. I imagine there's people taking sort of 30, 40, maybe even 50 milligrams of RAD-140 in a day. And it could be the same with things like LGD, like people don't understand the dosages they should be having. It's like if that guy was having 1 milligram of RAD-140 a day, there's a good chance that he wouldn't have sort of had the hepatotoxicity within his liver. But at the same time, it's like would there be any point in taking it at them doses? On the flip side to that, you know, like I said at the start, dosage and duration make the poison. So it's like you've got to weigh it up in your own mind, you know, whether you think it's worth doing or not. I would not recommend it personally based on what we've just read, and there's many more studies out there that sort of, you know, display similar results. These SARMs are so new that, you know, there hasn't really been any long-term research done on them yet. A lot of the sort of studies we've got and the sort of accounts we've got are anecdotal, which are limited in their sort of credibility. Scientific studies on each individual SARM are sort of harder to find, harder to dig out. There, you know, you can find them, but there needs to be more research done. And like I say, in that study it did mention that these could be a serious public health risk. So at the end of the day, do what you want, but make sure you're always informed about these things before you go spending money on any supplement. You should always be talking to medical professionals and doing your own research as well. So hopefully you found this useful, guys. Like I say, I was surprised at how much SARM use goes on in the UK, so hopefully this video is useful for some people. If you did enjoy the video and you're watching on YouTube, drop it a like, drop it a comment, whether you agree, disagree. It all helps with the channel. You can subscribe if you want. You can hit that bell icon as well, which will keep you up to date with any new videos I'm posting. You can head over to my Instagram, it's @SundayLifters, and if you want to get in touch for meal plans, sort of workout plans or online coaching, it's sundaylifters@gmail.com. Cheers again, guys, and I'll see you back here again soon.